Welcome back, everyone. The questions are still coming in about COVID-19 and the state's response. We continue our live Skype conversation with New Hampshire state epidemiologist Dr. Benjamin Chan. And Dr. Michael asks, how many tests have been given in New Hampshire since this started in March, and how many tests are being conducted daily?
Great question. We get asked about testing frequently, and I don't have the exact numbers on hand with me right now, but we have tested somewhere in the range of about 16,000 residents of New Hampshire for COVID-19. We are ramping up our testing in the last couple of days. We've tested anywhere between 800 and 900 people per day the last couple of days for COVID-19. That's an increase from where we were even a week ago, where we were testing maybe 400, 450 people a day. So we are working on making testing more available to the general public.
Patty asks, I believe I have already had COVID-19 back in February. Does this mean I won't catch it again?
Great question. We believe that when someone is infected with COVID-19, they develop some immunity, some protection, at least in the short term. How long that protection lasts for, I think, still remains to be seen. This is part of what the ongoing conversation nationally is about whether COVID-19 could make a resurgence later in the year or even next season. A lot of that conversation depends on a number of factors, one of which is how long a person's immunity lasts for after they're infected.
And Dr. Mary wants to know, since the CDC guidelines for face coverings have changed, I'm curious if the mask is to deter your spreading the virus to someone else. Why doesn't it also protect us from the virus?
So this question, I think, pertains to the CDC guidance on the use of cloth face masks or cloth face coverings. And this is an important question, an important point. 2-3 weeks ago, the CDC released guidance which we support around recommending cloth face masks when people are out in public in situations where they may not be able to appropriately social distance. The purpose of a cloth face covering or a cloth face mask is to primarily prevent the person wearing the mask from spreading the virus to other people in the event that that person may be shedding or able to transmit the virus before they develop symptoms. A cloth face covering is not primarily intended to protect the person wearing the mask, and so it's not what we call personal protective equipment. Again, it's primarily intended to help slow the spread of this virus to other people by controlling someone's respiratory droplets.
All right. Important question here from Christine, who wants to know, what's the status of plasma donations for COVID-19? Is this a viable option? And if so, shouldn't we be asking those who have recovered to donate?
Yeah, so there are routes for people who have had COVID-19 to donate blood or serum, which could potentially have, or we believe has, COVID-19 antibodies as a way to protect other people who might become infected. Right. This is something that is being conducted under an FDA emergency use authorization protocol, and so there may be health facilities and places that are able to do blood donation that are able to engage in this. There are certain criteria that people have to meet. So if someone has been infected and they have questions about this, I would suggest reaching out to the local blood bank or blood donor location to inquire more about it.
All right. Thanks, Dr. Chan. We always appreciate your time and expertise. Be well. Now we send it over. Thank you. And now we send it over to Mike with your forecast.